Personality Disorders by Laureano Andrade Vicente, MD 21, and MCAT Disciples. Let me start by saying this, folks. Many people have odd tendencies and quirks. These are not pathological, that is, they are not caused by physical or mental illness, and you wouldn't say that they're caused by physical or mental illness unless they cause significant distress or impairment in daily functioning. And as you read through this lecture, I will not continue to repeat that on every slide, but you should know that most diagnoses on the DSM-5 list this as a diagnostic criteria, that it has to cause significant distress or impairment in daily function for you to make that diagnosis, be it a mental disorder or personality disorder, that is, be it a mood disorder or personality disorder. It has to be present. Now, let me also stress this. Just because there isn't any mention of the daily function of a patient does not mean that when a question says what is the most likely diagnosis, that you can't pick a personality disorder or a mood disorder just because that isn't present, because it says what's the most likely diagnosis. And we'll kind of get into that shortly. Personality disorders are generally not diagnosed before age 18, but most of them can be if it had been present for more than a year, with the exception of antisocial personality disorder that has to be greater than age 18. Before that, it's called conduct disorder, but you don't need to know that for the MCAT. And obviously, it's a different diagnosis, but it's kind of the precursor to antisocial personality disorder. About 50% usually convert as an adult. But anyway, how do they ask personality disorders on the MCAT? We discussed this in the previous lecture on mood disorders, but I will say it again because it's that important. 4 things will usually be clear on the MCAT, and they will usually be presented in this order. The age of onset, which is usually between ages 10 and 30. The time course, which is usually in years, and in fact has to be at least in years. Features that cause significant impairment. And here's the critical thing. They will have normal vital signs. That is, their heart rate will be normal, their respiratory rate will be normal, their blood pressure will be absolutely, unequivocally normal in an isolated personality disorder, with the exception of the anxious types, which may cause episodic and usually mild elevations in heart rate, respiratory rate, or blood pressure in the times of intense anxiety. And they will give you those normal values on the exam. And if you do a physical exam, nothing. There'll be no findings. Again, maybe in the anxious type, they may be sweating, but other than that, their pupils won't be dilated. Their mucous membranes will be nice and normal and wet. They won't be dry or anything like that. They will be a normal physical exam on the patient. With that said, we can continue on. This is a composite image of number 6357 from the New General Catalog of Astronomy. Unrelated to our discussion today, but I just like to sometimes allow you to sit there and appreciate how beautiful our universe is. To proceed, personality disorders are arranged into clusters. Type A is the odd personality disorder group or cluster, which includes paranoid, schizoid, or schizotypal. Type B is dramatic, which includes histrionic, narcissistic, antisocial, and borderline personality disorder. And type C is the anxious, which includes the avoidant personality disorder, obsessive compulsive, and then dependent personality disorder. I'll try to repeat these as we go so you can remember the clusters, but we'll start with type A, the odd group, which again, paranoid, schizoid, schizotypal. And remember that order, especially for the type A, the odd. That helps me a lot, and I hope it'll help you in terms of remembering which one's schizoid, which one's schizotypal, which one's schizophrenia, which one's schizophreniform disorder. We'll get through that. So the paranoid personality disorder, it's characterized by excessive distrust and suspicion of others. The patient is excessively paranoid of others. And well, folks, the definition of paranoia is having an unrealistic distrust and suspicion of others, or the feeling of being persecuted by other people. And so you can just look for that definition in the vignette and you'll be able to get to the right answer. Enough about that. Now, schizoid personality disorder is characterized by a pattern of detachment from social relationships and a restricted range of emotional expression. They prefer to be alone and they have no interest in sexual experiences. That is the schizoid personality disorder. Prefer to be alone, restricted range of emotion, and no interest in sexual experiences. So we have this fella here not even paying attention to this woman trying to get his attention. Now, the schizotypal personality disorder is characterized by a pattern of acute discomfort in close social relationships, just like the schizoid personality disorder. But they also have eccentricities of behavior and thought. That is, they have strange behavior, strange ideas, and they tend to believe in things like clairvoyance and superstitions. I think that the distinction between schizoid and schizotypal is best understood by classic examples. So on the next page, there will be 3 classic presentations, and I'd like you to pause and try to identify them. And when you do, pay special attention to those 4 things: the time course, the features causing significant impairment, the lack of vital and physical exam findings, and finally, don't forget to code switch. We talked about this in the last lecture, but I'm going to remind you what code switching is and how important it is for you to do it. In the layman's terminology, code switching means when you go to your job, you don't use the same vernacular that you would with your friends and family. If you talk with slang with your friends and family, when you go to your job, you're very professional. You maybe change your voice a little bit, whatever it is you do. That's code switching. I like to use the term code switching to describe when you're studying medicine, to convert layman's terminology into the scientific and medicine terms that they represent. And so you'll get a taste of what code switching is when we go through the next few examples. A 33-year-old man says his wife has been having an affair with a gardener who works across the street. He also states that he was laid off from work because his coworkers badmouthed him to his boss. He refuses couples therapy because he states, "I know the therapist will side with her." This is paranoid personality disorder. If we think about what the definition of paranoia is, which is an unrealistic distrust of others or a feeling of being persecuted, this patient is really demonstrating that. If we look about, he thinks his wife is having an affair with a gardener. Okay, that might be true, but we keep reading. He thinks that he was laid off from work not because of something he did at work or that he was doing his job poorly, but he was laid off from work because other people were bad-mouthing him. So he had this unrealistic distrust of other people. Finally, what really puts the icing on the cake here is that he thinks he refuses couples therapy because he knows the therapist will side with her. Okay, this extreme distrust, this feeling of being persecuted is permeated throughout this entire passage. This is paranoid personality disorder. Now you might be saying, where is the significant impairment? Well, he got fired from his job. That's the code switch. That's the code switch for significant impairment. The rest of this is the code switch for paranoia. This is paranoid personality disorder. We move on. Oh, and the other thing before we go is, some of you may be thinking, well, how do I distinguish between paranoid personality disorder and delusional disorder? Let's help you out. Paranoid personality disorder is on the time course of years. It has to be pervasive throughout many facets of life and cause significant impairment. But delusional disorder is a fixed, persistent false belief system lasting at least a month, functioning otherwise not impaired. The delusional disorder patient has their one delusion, and everything else in their life is fine. They function normally, they work jobs, they have friends, they have families, and you would never know they have a delusion until you figure out or ask them about that specific delusion. So if they believe a celebrity is in love with them, it may not be clear in any other facet of their life that they're delusional until you start asking about that. Where the paranoid personality disorder, it's pervasive. It's in every facet of their life that they think someone's out to get them, that they think that they have this massive distrust of other people. Everyone is out there trying to con them. You get the idea. Moving on. A 47-year-old data scientist spends most of his time at his desk, and he has refused to join his coworkers for drinks for the past 15 years. When asked to work with other scientists, he does not contribute to group discussion and only speaks when spoken to. He has received several warnings about his behavior at work. He has never had a partner or close friend, and his thoughts are linear and goal-oriented. This is an example of schizoid personality disorder. And we can clearly see in this passage that for the past 15 years, there's that time course. He refused to join his coworkers for drinks every time they've invited him. I mean, wow, for 15 years, that is a big example of social detachment. He only speaks when spoken to. He received several warnings about his behavior at work. More examples of social detachment, as well as significant impairment. He has never had a partner or close friend. That the code switch for reading that is say, okay, social detachment, as well as potentially no interest in sexual activity. And his thoughts are linear and goal-oriented, aka he's not having any psychotic features. This is schizoid personality disorder. We move on. A 29-year-old female feels it necessary to go to the river every weekend for the last 8 years to try to summon the spirits of her ancestors, or else she may not be accepted by them at the time of her death. She has computers set up in her basement to try to communicate with extraterrestrial life. She wears 1900s clothing when going to town because she feels more connected to the past than the present. When asked why she missed the deadline that led to her being fired from her job, she cites that she could not miss her weekly river summonings. She has no auditory or visual hallucinations. This is an example of schizotypal personality disorder. And if we go through the salient points of this passage, she may not be the beginning of trying to summon her spirits of her ancestors, just kind of weird, odd behavior, an odd idea that she has. She's trying to communicate with extraterrestrial life. Again, a very odd behavior, odd ideas. She wears 1900 clothing to go to town to feel more connected, rather because she feels more connected to the past and the present. Again, very odd behavior, odd ideas. And it's causing significant impairment because she got fired from her job the other day. There are the code switches there, right? And as we're reading, again, you read these sentences and you got a code switch. You say, what is this? What is this an example of? What medical term can I apply to this example of this behavior? Okay. And now I just want to take a moment to make something very clear to you all. You keep seeing this at the end of these little vignettes. She has no auditory visual hallucinations. And in the last one, they said this speech was linear and goal-oriented. That is trying to tell you that these people are not experiencing psychotic features of disease. Schizoid and schizotypal personality disorder have no psychotic features, whereas brief psychotic disorder, schizophreniform disorder, schizophrenia will show psychotic features. What are those psychotic features? We talked about them in the last lecture, but as a reminder, they will have at least one of the following: disorganized speech, delusions, or hallucinations, most commonly auditory. This slide is just to put everything on one page for you. Because I know that distinguishing between schizoid and schizotypal, schizophreniform, and all that can be quite difficult, I've included 2 more questions. A 19-year-old man is brought to the clinic by his mother because the mother is concerned about her son's bizarre behavior. Over the past 4 years, he only dresses in black and red clothing with a long black overcoat, even during the summer. He does not have any friends and spends most of his time in his room playing online role-playing games. His mother states that he is anxious at college because he is uncomfortable around other people and his academic performance is poor. He spends a large part of his day searching paranormal phenomena on the internet, especially demons. He states that he has never seen a demon before, but that there are signs of their presence. For example, a breeze in an enclosed room is likely the breath of a demon. Mental status exams show the flat affect and poor eye contact. This is schizotypal personality disorder. How do we know? Time course. At least over a year, usually on the MCAT, several years. He had eccentric and strange behavior. He's dressing in black and red with a long black overcoat even during the summer. It's quite odd. It's quite strange. He doesn't have any friends and spends most of his time in his room. The code switch to that is going to be social detachment, a characteristic of schizotypal personality disorder. Also schizoid, so we're not quite done yet. The strange behavior, however, is not really seen in schizoid, but this is schizotypal. He's uncomfortable around other people, according to the mom. So that is an example again of this social detachment. And he spent the larger part of his day searching paranormal phenomena. That is an example of that eccentric behavior and ideas. Again, more eccentric ideas. He feels a breath in a closed room a breeze in an enclosed room is likely the breath of a demon. But he says that he's never seen a demon before. And that's where they try to confound you, right? They try to make you think that this is some sort of psychosis instead of schizotypal. But we notice that this patient, there is no mention of this patient having disorganized speech, having delusions, or having any hallucinations, that is seeing things that aren't there, or hearing things that aren't there, or feeling things that aren't there. So this is schizotypal. Let's move on to the type B dramatic cluster. This is my favorite cluster, I've treated a few of these patients in the hospital before, and you never know what to expect with them, and it always makes for an interesting hospital stay. So let's talk about the type B, the dramatic cluster, which again is the histrionic, narcissistic, antisocial, and borderline personality disorders. And we'll go in that order. All right, the histrionic personality disorder. They are dramatic, flamboyant, and extroverted and suggestible, but they are unable to form long-lasting, meaningful relationships. They have impressionistic speech, which I'll explain in a moment. They want to be the center of attention. They have rapidly shifting emotions and often perceive relationships as more intimate than they actually are. These are by far and away more common in women. And I like to think of these patients as emotional con artists. They pretend to be interested in you, although they do not do so consciously. This is just who they are. And we'll expand on this in the next few slides. And I want to also make something clear here. I'm calling them con artists as a way to remember them. They're not con artists. This is just a way in which I try to remember the presentation. We'll talk about more of this one in a few slides, so just hold on to that. The narcissistic personality disorder we'll also describe on another slide, but they have a pattern for grandiosity, a need for admiration, and a lack of empathy. They believe they are special and interpersonally exploitative. Now, what does grandiosity really mean? To be grandiose is to do things in a grand and magnificent way, to order lobster tails like they're shrimps, to wear expensive clothing or knockoff versions of it, to demand first-class seats and to drink only the finest cocktails. It's to do things in a grand and magnificent way. And the narcissistic personality disorder has a delusion of grandeur. They have a false belief system in their own superiority, and their grandiosity often manifests itself as a tendency to be uncooperative and to snub their noses, to raise their noses high in the air to services offered. Like this cartoon here is saying, "Hey doc, thank God you're here. I wouldn't let a junior doctor touch me, huh?" It's a snubbing their nose at what most people would use as for example, if they sit down at a diner, they have to be at the best table. They wouldn't dare to sit where everybody else in a crowded room with everybody else. I mean, if they go to the club, they need to be in VIP. They have to have bottle service. This is the narcissistic personality disorder. Again, remember though, before you start calling your friends narcissistic, it has to cause significant impairment in their life. We'll talk about this again in a second. The antisocial personality disorder, it's called the sociopath. They used to call this the psychopath, but we don't use that term anymore, but I just put it for historical relevance and to make sure everybody's on the same page about that. The antisocial personality disorder is a pattern of disregard for and violation of the rights of others. They're deceitful, they're exploitative, they lack remorse for wrongdoings. These are the people that often grow up to become serial killers. And as a child, they grew up maybe torturing animals, stealing, breaking and entering, getting into fights at school, and etc. But remember, this cannot be diagnosed until age 18. Before that constellation of findings is diagnosed as conduct disorder. But again, you won't be asked for that on the MCAT, conduct disorder. And this is an image of Dexter. It's a serial killer on a TV show. Finally, the borderline personality disorder. It's a pattern of instability and violent swings in interpersonal relationships, self-image, and affect. I haven't mentioned affect in this lecture yet, but I guess I will now. So affect, what affect is the phenotype of mood, right? Mood is what the patient tells you they feel, and affect is what the clinician observes and documents. So if a patient reports their mood is angry and I observe them to be pouting and slamming their head on the door, I would call their affect angry, and maybe I'd call it mood congruent, for example. Anyway, the borderline personality disorder has a pattern of instability and violent swings in interpersonal relationships, self-image, and affect. They have marked impulsivity and chronic feeling of emptiness, and they often engage in self-injurious behavior such as superficial risk cutting. The borderline personality disorder often engages in splitting, which is the act of characterizing actions and ideas and people or things as either all good or all bad. They're also incredibly vulnerable to abandonment, and they make truly frantic efforts to avoid real or imagined abandonment. The term borderline refers to the fact that they are on the borderline of neurosis and psychosis. We don't usually use the term neurosis very much, but what neurosis means is a relatively mild mental disorder, whereas psychosis is a full-blown psychosis. And often they have little psychosis episodes, but that's just part of their normal personality disorder, and you don't have to diagnose that as, a psychotic disorder. They have a suicide rate of 10%. So oftentimes their self-injuries, self-injurious behavior is very superficial and is not actually associated with any real possibility of killing themselves, but sometimes it is, and that's why their suicide rate is 10%. All right, we'll expand on some of these. The histrionic personality disorder. So I have the overly attached girlfriend here as the picture for that. Again, we've already talked about how they're dramatic and flamboyant or whatever. It's much more common in women. Is it going to be that way on the MCAT? Yep, it is. So you want to look out for impressionistic speech and suggestibility when trying to figure out if someone has a histrionic personality disorder. Impressionistic speech is that they will try to impress people on a grand scale and will do just about anything to accomplish that. So I have an example for you here. You might say, I like the movie Star Wars, and the histrionic personality disorder will respond dramatically with, you too? Oh my God, I love that movie. She's so dramatic and seemingly interested in you. It's infectious and makes you feel really special and possibly even loved by this great bubbly woman. And that's why I call them emotional con artists. It's the same thing a con artist would do, but they don't have that malicious intent. They're just who they are. Also look for suggestibility. You first ask their opinion and then present your opinion and see if they're swayed by it. So if you did that, their response would be something like this. Oh, wow. I never thought of it like that before. You are so smart. Tell me more. Interestedly looks at you. And they may not always have the voice that I'm using, but I'm trying to give you an idea of what this might look like. So I would encourage you to go click this link and watch this video. It's very short. I think it's less than a minute. And it can really give you a good idea of what this histrionic personality disorder might look like. It's worth it. Give it a look. We'll move on to the narcissistic personality disorder. And this cartoon says, hey, doc, thank God you are here. I wouldn't let a junior doctor touch me. Again, this narcissistic PD has a pattern of grandiosity, a need for admiration, and lack of empathy, and they believe they are special, interpersonal, exploitative, and they're more common in men. So I'm giving you this laundry list that you would find in the DSM-5, not for you to memorize the greater than 5 characteristics, because it's going to be pretty obvious if someone's narcissistic on the MCAT, but rather just to give you an idea of what you're looking for. A grandiose sense of self-importance. Again, we gave you that example of snubbing their nose at things that the common folk use, They have arrogant behavior. Again, they have this arrogant behavior. I mean, it's kind of very similar to snubbing your nose, so to speak. They have a sense of entitlement. They have a need for excessive admiration. They have, and this is what's probably going to be very, very clear on the MCAT. They have a need to associate only with people or institutions of the highest status, a tendency to be exploitative, unwittingly or intentionally, in interpersonal relationships. So, again, this guy is saying, "Oh, I wouldn't let a junior doctor touch me. Only the top senior doctors can heal me." They have a lack of empathy, and they envy others or a belief that others are envious of him or her. That's a narcissistic personality disorder. Now, a word. Antisocial narcissistic personalities are more commonly diagnosed in males, and histrionic and borderline personality disorder are more commonly diagnosed in females. And is it going to be that way on the MCAT? Yep. So that can be another clue for you. Oftentimes people get confused between narcissistic and histrionic. And it can be a clue for you, the sex of the patient. A 29-year-old unemployed man has been accused of killing a couple after robbing them in a dark alley. He pretends to be sleeping as he lies in the prison cell. As a child, he has had several stays in a juvenile detention center for multiple crimes, including grand theft auto. This is actually an example of the antisocial personality disorder. And if we look at the salient points in this passage, we've been told that he's killed a couple after robbing them in a dark alley. This is a violation of the rights of others, and it's quite the heinous crime, and there's reason to think that you didn't have to kill the person if you robbed them in a dark alley and your face wouldn't be shown. Not to mention just killing someone in general is it really begs the question of, does that person feel remorse for that? He pretends to be sleeping as he lies in the prison cell. This is actually an example of something that antisocial personality disorder individuals often do. They often pretend to engage in activities that are expected of them in a particular situation. You should code switch this as deceitful and exploitative. For example, an antisocial personality disorder will often learn to cry in situations where they are supposed to be feeling an intense emotion such as a sadness. Even though they don't feel that, however, they pretend. As a child, he had several stays in a juvenile detention center. This is classic history. Antisocial personality disorders often have a long history of disregard for the law. So this is best diagnosed as antisocial PD. We move on. A 22-year-old female presents with superficial scarring on her wrists, as well as a few fresh lacerations in the same area. When questioned, she states that her boyfriend of 4 weeks had broken up with her. She states that all men are jerks and she will never bother dating again. She states that she often feels like no one in the world cares for her. This is an example of borderline personality disorder, and we note the self-injurious behavior, the impulsivity. If you read the rest of the passage, after 4 weeks of dating someone, she decides to cut her wrists. Very impulsive. Very much an example of emotional instability and instability of relationships. She states that all men are jerks and she will never bother dating again. This is an example of splitting, saying things are all good and all bad. She also states that she has this feeling of emptiness. This is very characteristic of borderline personality disorder, and it's a female, which again, this is very common. It's not very common, but it's most commonly diagnosed in females. A 35-year-old woman comes to your office complaining that the weather makes her feel she is burning like a stove. "Oh, doctor, it feels like I'm in hell's furnace and the heat is turned all the way up." She then comments, "Wow, doctor, that is a beautiful tie. We ought to grab lunch together after this and catch up on things." This is your second visit together. This is an example of histrionic personality disorder. They're quite dramatic, as you can see, burning like a stove. I'm in hell's furnace and the heat is turned all the way up. And the comment of, "Wow, doctor, that is a beautiful tie." I mean, that's very inappropriately familiar. But particularly what comes after is that she's perceiving their relationship as more intimate than they actually are. And this is very characteristic of histrionic PD. A 49-year-old CEO presents to the emergency department after an automobile accident. He states that he will only be treated by a senior physician, citing that he is an extremely valuable member of his company. While sitting in the emergency department, he is heard shouting business commands into his cell phone. When he is asked if he would like a hospital sandwich, he states, "As if I would ever eat such an unbecoming meal." This is narcissistic personality disorder. And remember, before you go around diagnosing your friend as narcissistic, remember it has caused significant impairment. The number one here is representing, haughty behavior. That is being arrogant and disdainful. That is haughty behavior, being engaging in arrogant and disdainful behavior. And saying that he has to be treated only by a senior physician is also an example of the need to associate with people or institutions of the highest status. He also had a very grandiose or grand sense of self-importance, as demonstrated by he is an extremely valuable member of his company. He's shouting business commands into his cell phone, making sure everybody can hear him. Oh, that's haughty behavior. That's arrogant. That's disdainful. And finally, he says, as if I would ever meet such an unbecoming meal, raising his nose and saying, huh, please. That's a big time haughty behavior. That's narcissistic personality disorder. So type C are the anxious cluster. And remember, these ones are the ones that when they are acutely anxious, they may have transient changes in their heart rate and the blood pressure might go a little bit up. So don't be confused there. But otherwise, all the other expectations you have about personality disorders will be there. The avoidant personality disorder, they have a pattern of social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation. And they're preoccupied with being criticized or rejected. The image right here exemplifies these thoughts. They must think I'm useless. I wish I had the courage to talk to him. Now let me make this clear. Remember, these thoughts have to cause significant impairment. If you have an avoidant PD, it's not like you get a little anxious before talking to a group. No, your mind is running a mile a minute. You usually produce little or no information because you are paralyzed with fear again and again and again. So it's not just like they get better. It's not like, I'm talking like if they're the group of 2 or 3 people and it's just a, casual group, this is going to make them very anxious. So this is not just some little bit of anxiety, guys. This is not just some little tiny bit of anxiety before having to give a presentation. No, you will have a really hard time getting an avoidant personality disorder to even get up on a stage. All right, obsessive compulsive personality disorder. It's characterized by a pattern of preoccupation with orderliness, perfectionism, and control. They are preoccupied with rules, lists, organization, and schedules. These people often feel the need to micromanage aspects of their friends and family at work or during trips. And the key distinction between obsessive compulsive personality disorder and OCD, or obsessive compulsive disorder, which we discussed in the last lecture, is that in OCPD, they generally do not find this behavior problematic, and a little science term for you here is egosyntonic. They do not find the behavior problematic, and that's called being egosyntonic. Whereas OCD is egodystonic. They do find the behavior problematic, and it causes them great distress. And remember, like we said in the last lecture, the obsession is the thought, the compulsion is the act. All right, dependent PD. Dependent PD has a pattern of submissive and clinging behavior related to an excessive need to be taken care of. They feel helplessly alone and need constant reassurance, and urgently seeks another relationship in one end, and are prone to depression. An example. A 30-year-old female rarely goes out with her coworkers and often makes excuses when they ask her to join them because she is afraid that they will not like her. When asked questions in social settings, she often has difficulty expressing herself. She wishes to go out and make friends, but according to her, she is far too shy to do so. This is the passage that is an example of avoidant personality disorder. We see here that she is expressing social inhibition, particularly with the preoccupation of being rejected, is the big key identifier for an avoidant personality disorder, because they are avoiding particular situations because they have a preoccupation with being rejected or have negative evaluations of themselves. We also see that she has difficulty expressing herself in social settings, another example of social inhibition. And in fact, the passage goes on to say that she wants to engage in these social activities, but she can't because she's too shy. So it also clearly distinguishes for you that this isn't social It's not that she doesn't want to engage in social interactions. It's not like the schizoid or the schizotypals, but that she's just too scared to do so because of these negative evaluations, too preoccupied with being criticized or rejected to do so. So she avoids those interactions, hence the term avoidant personality disorder. Another example. A 41-year-old store clerk was recently fired from his job because of inability to complete his counter closure on time. According to him, he stated that all the bills had to be counted starting from highest to lowest, and that any bills that were partially stained or tattered had to be removed from the stacks without exception. He often has to recount because he believes he missed a bill. His employers have brought his slow speed to his attention multiple times in the past, to which he feels they do not give him enough time. This is an example of obsessive compulsive personality disorder. And here in this passage, we note the obsession of orderliness and the compulsion of recounting. Another characteristic is that he re-engages in the compulsion several times. And in fact, what makes a compulsion is that it's time-consuming and that it is not realistically associated with the thing that they are trying to accomplish. That is kind of what defines a compulsion. It's a behavior that occurs in response to an obsession that is not realistically associated with preventing the obsession. And finally, it's very time consuming and of course causes significant impairment. And it's also here an example of egosyntonic. He feels he doesn't get enough time. He doesn't recognize that this is inappropriate. This is obsessive compulsive personality disorder. A 33-year-old female who lives with her mother has difficulty deciding where to purchase a new couch. She has been unemployed for the 4 years, and her last job was working at the same place as her mother. She calls her mother several times a day to ask very trivial things. I think, and there's only one personality disorder left, but this is dependent personality disorder. And here we note the clingy behavior. She lives with her mother, so it's very clingy. A 33-year-old. Again, I'm not trying to shame any 33-year-olds who live with their mother, but if we read the rest of the passage, she also called her mother several times a day to ask trivial things. So the last time she was working, she worked with her mother. I mean, this is dependent personality disorder. Again, this is just a list of the three questions, of the three passages, just to put it all on one page, and now we can just go ahead and summarize the lecture. The type A of the odd is the paranoid, schizoid, schizotypal. Paranoids, they're suspicious of other people. Schizoid, they prefer to be alone, detached from social relationships, and no interest in sexual experiences. The schizotypal, they have acute discomfort in close relationships, so they are also detached from social relationships. They have cognitive distortions and odd behavior and beliefs. Type B are the dramatic, the histrionic. They're dramatic. They need to be the center of attention. They're shallow. They're sexually inappropriate, and they have the tendency to perceive relationships more intimate than they actually are. The narcissistic believe themselves special. They're arrogant, and they're insensate to the need. They have an incessant need to associate with high status people and markers. They think very highly of themselves. The antisocial personality disorder, they have a lack of regard for social norms. They have a lack of empathy. They do not respect rules or regulations, and they feel no remorse for the sins that they commit. These are the people that grow up to be serial killers. Often, they don't always have to be. Anyway, borderline personality disorder is an unstable self-image and interpersonal relationships. They are impulsive. They engage in splitting. They engage in superficial self-injurious behavior, suicide rate of 10%, and they border on neurosis and psychosis. Sometimes they get a little psychotic. Sometimes they have a more mild course of disease. Type C is the anxious, which includes avoidant, obsessive compulsive, and dependent. Avoidant is socially inhibited. They are socially inhibited due to fear of inadequacy and judgment. The obsessive compulsive PD is the preoccupation with orderliness, cleanliness, and scheduling. And remember, this is egosyntonic, the personality disorder. And it's easy to remember that the personality disorder is the one that is egosyntonic because they've been having this for years and years and years and years, and they've never recognized it to be a problem. The dependent personality disorder is submissive and clingy and feels helpless alone. All right, that is all she wrote for the most part anyway. The treatment is available, is pharmacologic and psychotherapeutical, and are symptom-based. So if they're anxious, you usually give them an anti-anxiolytic medication. And remember, acutely, you can give a benzodiazepine, but for more chronic management, you give an SSRI or selective serotonin reuptake inhibitor. They don't really ask about treatment on the MCAT, so don't worry about it. But if they do, cognitive behavioral therapy is almost always a good answer. It's a type of psychotherapy. To let you know, we have an AMCAT prep course that ranges in price between $49 and $398. You'll receive video lectures and examples on logic, personal disadvantaged activities, and secondary essays, and expert review of personal disadvantage and activities section of the AMCAT application. Please visit MCATdisciple.com/AMCAT to learn more about this wonderful, wonderful opportunity for you to spruce up one of the most important applications that you've ever submitted in your entire academic career.